Siemonh, women's health nurse practitioner.
Sorry, let me unmute myself. That would help, right? Hello, everyone. Thank you, Cynthia. Yes, I am Ashley. I am a women's healthcare nurse practitioner. I graduated from Towson University in 2013 as a registered nurse, and I worked for 6 years in various specialties, including medical, surgical, cardiac intensive care units, and gastrointestinal. I then went on to obtain my master's degree in 2019 at Georgetown University, where I became a women's healthcare nurse practitioner. And throughout all of my studies and my RN experiences, I knew I wanted to settle down in women's health. So currently I provide care for women across the lifespan, including prenatal, postnatal, obstetric care, and I absolutely love what I do. I think it is very important that Black women especially have a place where they are treated for and cared by women who not only look like them, but also understand the major health disparities when it comes to healthcare and minority women. So I love that we're doing this event. I love that we're talking about everything health and wellness into your 2022. So in order to maintain good health, it's important that you're consistent with your yearly checkups. There's a lot of diseases that are considered silent killers. For example, high blood pressure or hypertension, where you may not have any symptoms at all. You could be living your day-to-day routines and suddenly you have a stroke or at worst even die, not having any clue at all that you had high blood pressure. So a lot of these silent killers are picked up through these annual examinations that you receive yearly, or you should be receiving yearly. And it's important that you do that because although you may be feeling fine and externally everything looks okay, it's important that you're getting these physicals done, you're getting your blood pressure checked, you're getting your wellness labs done, so we can make sure that internally your body processes all are functioning normally, okay? I always love to say preventative health is the best health. So that brings me to what I specialize in, which is well woman exams or annual exams, as some people call them. So these exams are more focused to the female anatomy and reproductive system. So we're examining your thyroid, we're doing a breast exam, we are doing a pelvic exam, we're looking at your vaginal tissue, your cervix, your ovaries, your uterus, making sure that everything looks healthy and appropriate. And so this is where education plays a huge role. One of the reasons why I decided to specialize in women's health is because I know how intricate and unique the female anatomy is. And I also understand that, you know, we as women are undereducated about our own bodies, okay? And I wanted to be there to help close that gap. So I love having the ability to educate people and use this visit where education can truly and really shine. I think that one of the biggest educational pieces that I see on a day-to-day, especially doing these well women visits, is the difference between a Pap and a Speculum, for example. So I got a little prop. So this is a Speculum, okay? We use this tool to help look inside the vagina. We're looking at the vaginal tissue. It helps us examine the cervix well, okay? This in itself is not a Pap smear, where most people kind of get that misconception. And even before I even started my nursing career, I used to think that every time you get this inserted, you were getting a Pap smear, and that's just not the case. So I love being able to really explain to people the difference. So not a Pap smear, a Speculum. A Pap smear would be using these tools. This is my little drawing illustration that I have here. So these are different instruments or tools that we use to conduct your Pap smear, which is a cervical cancer screening that I'm going to talk to you about a little later. in the presentation. Another common misconception is between having a Pap smear done and having vaginal cultures done. I find that some people use the words simultaneously and they think that they're synonymous, that if you're having a Pap smear, you got vaginal cultures. If you got vaginal cultures, you had a Pap smear. Two separate things, okay? So like I said before, Pap smear, we're using these tools. They kind of look like these tools. You might not use all of them, but these are different tools that we can use to do a cervical cancer screening. Whereas when you do vaginal cultures, it kind of looks like the easiest thing to compare it to would be cotton swab. It kind of looks like a cotton swab. And when we do vaginal cultures, we are talking about looking for different vaginal infections. That can include bacterial infections, yeast infections, sexually transmitted infections. Okay, so again, two different things. And then I love to educate people just about the female anatomy itself. The vagina itself. There's so many times that I see people, they don't know the difference between, you know, where they urinate from versus where they insert a tampon or where a penis is inserted or where you have a vaginal delivery. They think that the urethra, which is the medical term, and the introitus or the vaginal opening are the same thing, and they're not. They're in close proximity, but two different things. So I think that it's really important that we know more about our bodies as women, and I love to have that opportunity to do that at all of my visits. And I think that's important for women, for us to use that opportunity to ask more questions, okay? Ask for things in layman's terms, because I know a lot of times you can hear this medical jargon. It sounds absolutely foreign and you're like, what? But then you're afraid to say it. You're afraid to ask, like, what do they mean? You just nod your head and say, okay. I don't want you to nod your head and say, okay? Ask for things to be written down if need be. Make sure you leave with the understanding of what just happened at that visit and what the plan is moving forward. I think that it is my job as a healthcare provider to inform you of what I am doing or prescribing and why I am doing or prescribing it for. But a lot of times I'm finding that specifically with my new patients, if I get a new patient and I ask them, you know, why are you taking this medication? Or why did you have this diagnostic pelvic sonogram done? They can't tell me why. They say, I don't know. And I am here to tell you today, you should never take anything or do anything that you don't understand why you are taking it and doing it for, okay? There is a major health disparity when it comes to Black women, and it is multifactorial, which can include income, socioeconomic status, trust, or should I say distrust within the healthcare system. So knowing that, right, I can't expect you to know what types of questions to ask, but that's why I love seminars and workshops and educational events like this, because I can express to you guys and educate you guys to make sure that you continue to be an advocate for your health and don't take no for an answer. I really try to restore and build trust with all of my patients because I understand and I know that as Black people, we have lost trust. We have lost trust with our healthcare providers, and that's very unfortunate, but also I can understand why, right? Black women's concerns just aren't held in the highest regards like our racial counterparts is, and that's very sad. So I tell my patients, don't stop at no. Don't stop at trying to be heard. You know yourself better than anyone else. So if one provider won't listen to you, you go to the next one. You get a second opinion, okay? That's all really important. I literally just had this patient yesterday share a story with me that she was having migraines for several months. And she had told her primary care provider about it, and they thought it was her blood pressure. So they adjusted her blood pressure meds. They kept increasing her meds. And she would say, you know, I'm taking my meds, I'm eating right, I'm decreasing the salt in my diet, but I'm still getting these headaches. I think that there's something more. And again, what did they do? Just adjust her blood pressure meds, just keep increasing her blood pressure medication and changing her blood pressure medications until she said one day, I need an MRI. I know that something is not right with my body. Order me an MRI. She said her provider laughed at her and said, I don't think you need one, but okay, fine. Like, I'll just give you one. She got that head MRI done. It turned out she had a brain bleed and needed emergency surgery. Okay. And so with that, she could have died. And you know what? The only reason why she didn't die was because she didn't take no for an answer. She kept pushing, and really made sure her voice was heard. And I think that that's really important. I think that we need to definitely be accountable for our own health. I think that's really important, not for ourselves to know our own health history, but for our future generations after us. It's really important to know your health history for sure. Another topic that I wanted to discuss was something that I feel like I see a lot of the time when it comes to problem visits and complaints that I see women for. The most biggest complaint would be bacterial infections or yeast infections. So it's definitely something that I wanted to discuss today. So as women, we normally have good and bad bacteria in our vagina. There's typically an equal balance of both, okay? It is when that bad bacteria starts to outweigh that good bacteria, that's when we end up with situations called bacterial vaginosis, or BV for short, okay? Bacteria like warm, dark, moist environments. That is our vagina all day, every day, okay? And so any little thing that we do, we can disrupt the balance between bacteria and leave ourselves in a situation where we're getting bacterial vaginosis, okay? And so things like douching, things like smoking cigarettes, using scented soaps on the vagina, wearing or using, taking frequent bubble baths, exercising and not changing into a pair of clean, dry cotton underwear directly afterwards. Sexual activity even. If you think about it, penises are dirty. Guys touch everything all day long. All their germs are right on their hands. When they go pee, those germs go right on their penis when they go pee and inside your vagina during sex. So I always educate on proper sexual hygiene. I always tell women what you use for your vagina, your man should use for his penis, okay? And so what I tell people, a small amount of Dove, okay, where the hair grows is appropriate. But in the inside inner lips, all you need is warm water, okay? And even semen sometimes can disrupt I'm so sorry about the noise in the background, but even the penis sometimes can disrupt, not the penis, but the semen sometimes can disrupt our vaginal flora and our pH balance. So I tell people, don't have him ejaculate in you, okay? Make sure you're wearing condoms all the time. I think that's also important. And then when it comes to yeast infections, so yeast like sugar. So if we're having a diet that is high in simple carbohydrates, that would include bread, pasta, rice, sugar, sweets, soda, candy, all of that can, put a petri dish for you to develop a yeast infection. So what I tell people is that you want to make sure you're eating a nice, well-balanced diet. Lean meats, fruits, vegetables, you're exercising. You can take a probiotic. That's also very helpful. You can get them from on Target, okay? Those are different things that you can take to help. The biggest thing would be to make sure that you are storing it correctly. That's very important because some of the probiotics need to be stored appropriately in order to keep the active ingredient. So I think that's all very helpful for good vaginal health, okay? And so the next thing I wanted to talk about was the Pap smears, which I mentioned earlier about the cervical cancer screening. So a Pap smear is a cervical cancer screening looking for abnormal cells in the HPV virus, okay? HPV, human papillomavirus, is the known cause of cervical cancer, and it's the most common sexually transmitted infection, okay? So we have the Gardasil vaccination. That is the vaccination used to help prevent against the high-risk strains of HPV that we know can cause cervical cancer. All right, and so the recommendation is that between the ages of 25 and 26, or 25 and 65, you are getting your Pap smears. This is a newer recommendation within, I would say, like the last 2 years. It used to be that you start your Pap smears at the age of 21, but that recommendation has now changed. There also is an outdated recommendation that you do yearly Pap smears. And so insurances are still covering Pap smears every year. So if you come to me and you're like, oh, I just feel more comfortable having a Pap smear every year, insurance is still covering it, so I'll go ahead and do it. But really and truly, the recommendation is if you've had normal Pap smears every 3 to 5 years, okay, is when you should be getting a Pap smear. Now, that does not mean that you don't get your annual exams every 3 to 5 years. You still get your well woman exams and your annual exams yearly, but a Pap smear may or may not be conducted at that visit. And like I talked about earlier, there's so much more that goes into a well woman exam than just the Pap smear, okay? So why the reason for the change, okay? We understand that cervical cancer is a slow progressing disease. And so studies have shown a regression, especially in those less than the age of 25, regression and no associated health outcomes in that young age, and find that if you actually repeat their Pap in about a year or 3 years, the HPV is undetectable, okay? And so when we were doing yearly Pap smears, especially in the younger population, when they were less than 25, let's say their Pap smear would be abnormal. That would cause a lot of anxiety within the patient, within the woman, distress within the woman, and then now we would have to order a follow-up colposcopy. A colposcopy is a diagnostic procedure where essentially we're doing a biopsy of the cervix, and we're sending it off for testing to make sure that there's no precancerous or cancerous cells. Colposcopies are expensive, okay? So now we are dealing not only with the woman's anxiety of this abnormal Pap, but the expense of having a colposcopy just for her to have a repeat Pap smear done a year or 3 years later and show that the HPV is undetectable. So all in all, the research has shown that the benefits did not outweigh the risk when it came to conducting yearly Paps, especially in women under the age of 25. Now, I'm speaking about women specifically who are not immunocompromised, okay, and have a history of normal Pap smears, okay? So it's kind of, okay, when you are working with immunocompromised population, the screening recommendations are a little bit different. Okay, so the overall mortality rate from cervical cancer among African women is more than 2 times higher than white women, okay? But studies have found that African American women are being screened for cervical cancer at rates that are similar to white women. So what is really causing this gap, right? Some people had said that it could be the inadequate follow-up of screening, or that it could be the differences in treatment options. So I think that it is very, very, very important to make sure that we are getting our routine Pap smears. So your provider may decide to do them every 3 years. You have other providers that go on the every 5 years with co-testing. That is a discussion, a shared decision-making process that you should have with your providers. Again, I think that especially coming from a women's healthcare background, I am never one to dictate another person's health. This is a partnership. You are the driver. I am just in the passenger seat saying, hey, I think you should make a left over there. But if you want to try and make the right, go for it. it's a shared decision-making process between the two of you. So if you and your provider decide that you want to still do them yearly, or you want to stick on the every 3-year routine, I think that is a discussion with you and your provider. But I think that as long as we make sure that we're keeping up with our routine Pap smears, that's what's important. But what also is important is the follow-up after that. There's been a lot of times where you have patients that they're coming to me 5 years after having an abnormal Pap smear where they needed to have a colposcopy. They never received the colposcopy. Now we're 5 years plus later, and they have full-blown cervical cancer or stage 3 abnormal cervical cells that require more treatment than if they would have just had the colposcopy and it been addressed more quickly. So I think that not only making sure you keep up with your routine PAPs is important, but making sure that you keep up with follow-ups. And this just goes outside of just Pap smears, your health in general. Making sure that you keep up with your follow-up exams. I think that's also very important to make sure we maintain that health, okay? And so now with the HPV vaccination, they have increased the age to get it until 45. The cutoff used to be 26, and now it's 45. So that's opening a wider range for people to get vaccinated. And what's really nice is that the vaccination is also offered to kids as young as 9. And so we're finding that when I'm seeing my patients, my 21-year-olds, my 18-year-olds, but remember, I'm not doing a PAP in someone who's 18. I ask them if they have history of the Gardasil vaccine, which is the HPV vaccination, and they're telling me, yes, they got it with their pediatrician. So that is really the move and the push now for kids or for women and men, actually, and boys and young boys, to get them earlier to really help decrease this, the rise in cervical cancer, okay? I also felt like I could not do this presentation with not at least touching on the COVID-19 vaccination or COVID-19 vaccination. We all kind of say it different sometimes. And so I definitely recommend and encourage the vaccination, okay? I think that as a society, I completely, as Black people, as minority people, I completely understand the fears that come with getting the vaccination, given the history of how us Black people and African Americans have been mistreated when it comes to healthcare, when it comes to feeling like we're just experiments. So I get that. And when I talk to my patients, I don't just talk in a healthcare lens. I also bring my own personal experience to that. I think that makes it more relatable, and I think we can just have a better connection that way, where you feel like someone is not just talking at you, but also talking just with you. And so for me, myself, I had my own reservations getting the vaccination. I was hesitant at first. It really took me reading the research, okay? Reading the clinical trials, doing my own research. And when I say doing my own research, I mean through reliable sources, okay? Not just social media. I went to healthcare experts. I actually read the studies myself. And I did a lot of prayer. I prayed on it because I was nervous. I was nervous, I have to admit. But through all of my research, through all of my prayer, it led me to make a decision that was bigger than myself. So I did get the vaccination. I did not get the vaccination for myself. I decided to get the vaccination for everyone else, those around me, my patients, my parents, my family, my friends, okay? Understanding that I am in a high-risk environment, being a healthcare provider, being in the front lines, being more at increased risk to be exposed to it, I never wanted to have the fear of potentially leaving work and exposing someone else around me. And so that is my driving force for why I got it. I think that everyone has to find their own personal reasons for why they would want to get it. But I do recommend that you get it. And this is, obviously you have to consult with your healthcare professional, because some people do have certain conditions that make them ineligible to get the vaccination. So definitely do that. But speaking to the people that, you know, you don't have any healthcare conditions contraindicating you from getting the vaccination, I do recommend that you get the vaccination. I recommend that all of my pregnant patients get the vaccination. My breastfeeding patients get the vaccination. I think that what I hear a lot of times is, you know, we don't know what it's going to do to us 5 years from now, 10 years from now. And that is true, right? Like, we don't know. And when the studies were being conducted, and now I'm speaking from my OBGYN side, when I have my pregnant patients, when I talk to my pregnant patients about it, you know, the clinical trials weren't done on pregnant women. However, with the trials, some women ended up getting pregnant during the trials. And up to this date, their infant themselves have been fine, okay? And so with what we know about the type of how the vaccination was made and our history with other vaccinations, that this is not harmful to the fetus, to the infant. Now, long term, we don't know the effects of the vaccination, right? But we do know the effects of COVID. We do know that Black people are more affected and dying from it. We do know that pregnant women are more immunocompromised and are hospitalized, having blood clots from the vaccination, but from COVID-19. Okay, so we know the effects of getting infected by COVID-19 are. We're not scared of that, but we're scared of what the vaccination can do 5 years from now that we don't know. We're not afraid to die now, but we're afraid to die later. You know, you kind of got to ask yourselves those types of questions. And I think that you have to make the best decision for you and pray about it. But it's definitely something that I think that I definitely highly recommend and encourage. And I think it's important to decrease the stigma and the fear that is surrounding it, which I completely understand where it all stems from. But I'm here to tell you today that, you know, I am fully vaccinated. I've received my booster. I have my loved ones surrounding me that I kind of coerced into doing the same thing. Some were more, you know, willing to get it than others, but everyone around me has gotten the vaccination and we're all doing well. And I would get it again. I would get it again. And I definitely recommend getting it. I think that is important, especially as we're going into as we're now newly into 2022. We have the Omicron virus that is like out ahead. And it's sad, but I don't really see an end in sight when it comes to this. And so I think that we need to focus on what we can do now in this moment to not only help ourselves, but help others. I think this is a time where we have to try to be selfless. And, you know, as people, we can be selfish. So I think this is a time where we have to be selfless and think about those around us. And I definitely recommend that in consultation with your provider that you get the vaccination, okay? Thank you so much for listening to me. Thank you all for just being here, and the presenters have been amazing thus far. So I'm really hoping that if you didn't take anything away from me just now, you've taken something away from all the wonderful providers and the presenters here today. So thank you so much. If we have time for questions, I'm all for it.
Thank you so much, Ashley. This has been really informative. There was a question in the chat. Someone wanted to just confirm what you were saying about the recommendation. 25 years or older for females get Pap smears every 3 to 5 years. Is that only if your Pap smear is normal?
So the recommendation now per the ASCCP guidelines is that we start doing routine Pap smears at the age of 25. It used to be the age 21, but now, regardless of sexual history, they recommend that you start it at 25. Now, I must admit that given certain providers' experiences when it comes to cervical cancer screenings and Pap smears, and experiences that even in my office, we are still doing them, starting them at the age of 21, especially more so if the person has a more high-risk history. But the recommendation is to now start them at 25, and they are every 3 to 5 years, provided that a patient has had normal Pap smears in the past, okay? And so this 3 to 5 years doing Pap smears, that has been long-standing. That has been the recommendation for several years now. But I think it's because insurances still cover yearly Pap smears. Patients have been used to getting a Pap smear every year. Also, the misconceptions that I talked about earlier between people thinking, are they getting a Pap smear with every speculum exam? I think people automatically thought that, okay, I'm getting this inserted, I got a Pap smear. So I think that all of that play a role into people thinking that they need to get a Pap smear every year, when that's really not the case. For my patients, I let them know the recommendation, which is every 3 to 5 years, as long as I know her Pap smear history has been normal, and she is not high risk, like an HIV patient, for example. But outside of that, if you decide and we have a conversation that you feel more comfortable getting them done every year, I don't have any problem doing it every year if insurance is covering it.
I don't know if I could find words to describe how much I appreciate you sharing all of this. I think for many people, you may have created a less threatening medical environment for women. And I really appreciate you showing the tool. I can tell you, for me, when I go in, I expect to see that tool, and there's like that happens because of the discomfort that comes along with that. So showing the tools and even showing the pictures, helping us understand what should be used and why it's being used, and helping us find our voices and being able to ask questions, say what our fears are, say what our concerns are, say what services we would like to receive, and even going as far as asking, why are you doing this? What is the logic behind what you just did? What should I look forward to? What should I look out for? So this has been really, really informative. I think I saw someone say in the chat room something about your perspective and your personality. I agree with them. I think if my doctors had your bedside manner, I don't know if that's the right word, but I think if they had it, I wouldn't have been so terrified about going to the doctor in my younger years.
Yeah, and I think that it's important for us to, vet our healthcare providers and do our research and make sure you're finding someone that really speaks to you, that you feel like represents you well, and that really understands your healthcare needs and your desires, and not just go to just any old body, as I think it should be like an interview both ways, You're there interviewing me, are we a good match? Are we a good fit? I think that's important for your healthcare, for sure.
Yeah, and a conversation about your health instead of they just go in there and they check the dark places and you get out and you walk away.
No, no. And like, I love when I get I like well woman exams, but I really love my well woman exams for my patients who it's their first one. I think that is the moment where it's like a make or break, right? Like you really, it's the first well woman exam that sets the tone for the well woman exams for the rest of your life. So I've had patients come to me in their 40s. So they've had several well woman exams and they're traumatized from the very first one that they had. And so they're like, that was like the best one that I had. So I think, and I also think it's important to manage expectations, right? So if you are getting a speculum exam and you never had one before, it would be why I tell all my patients, it's going to be uncomfortable. It's not the best thing in the world, right? Like to go in blind, not knowing what you're going to feel. And it's important. I let all my patients know what I'm going to do before I do it. Ask permission to do it. Okay. Like I said, it's not a dictatorship. It's a partnership. And I think that's really important for everyone's community. Like we just have to have an open line of communication. And no question is a stupid question. So please, I love when I see people ask questions, bring in their notes and take notes at the visits. We go through a lot of stuff. I say a lot of stuff. It's hard to remember. So take your notes. It's fine.
Yeah. More than just the STD check.
Yes, way more. I'm going over your health history, everything like that. And it really shocks me how many people don't know about like their health history, like their parents' health, their sister's health. You know, it brings to light that we don't have a conversation. Like we don't talk to each other about it. Like, hey mom, like, you know, how was grandma? You know, like what's going on with your health here? Or what's going on with your health history? Dad, like, I noticed you're taking these medications. What are you taking these medications for? You know, I think that we just need to have better dialogue, especially as Black women and as a Black society. I think it's very important for us to have the communication and the conversation. So I love this type of stuff.
We have another question. Is there a word on, can you give some information on throat cancer? Did I read that right? And HPV correlation in men?
Yeah, and so when it comes to HPV in men, we really focus on the perspective of men who have sex with men, right? And so HPV, we understand that it spreads sexually, but it also is one of the STDs be spread through skin-to-skin contact. So you don't necessarily need the penis inserted into the vagina or the penis inserted into the anus or rectum to transmit it. It could just be the genitalias rubbing together. It could just be if you have a lesion on your throat, in your throat, or on your penis that rubs another open lesion or open orifice that you can get contact. And so when it comes to men who have sex with men, I believe that they do Pap smears. I don't know if it's as routine as women. So Pap smears for men who have sex with men are usually in the anus. And so we worry about when it comes to HPV in men, that you can develop throat cancer. And even in women, though, sometimes too, you can get genital warts, not only in your genitals, but you can also get warts in your throat. For men, you can get HPV in your throat, and that can develop into throat cancer. So that's definitely something that's why the recommendation is for men and women for the HPV vaccination. It's not just for women. So boys and girls starting at the age of 9 are recommended to have the Gardasil